Knock, knock, knock. Hi, Mrs. Smith. It's Rachel again. Hi, we're going to be removing your catheter today, so great news. And I'm going to start with some hand hygiene. I'm doing my hand hygiene. I've provided the patient privacy. I've done all my other checks from our previous video, and I'm going to skip that part, get straight to removing the catheter. And I'm going to instruct the patient what's going to happen and what she needs to do during the procedure. And I'm going to put my gloves on here, and I'm going to make sure that my patient is in a comfortable position, and I'm going to be taking her bed linen down, okay, and she would have her gown right here. If not, then I would be placing a bed blanket here for her modesty. Okay, and then I'm gonna bring the bed blanket up, or bring her gown up, and I'm going to take a look at the catheter, see how it looks, and I'm going to detach it from the bed, and I'm going to drain it of all excess fluid. Okay, and I'm going to place it right here right now, and I'm going to make sure the patient is in a comfortable position. Okay, and I'm going to instruct the patient that when I take the catheter out, I need her to exhale. Okay, so I have her legs are in a comfortable position. I'm going to place a drape in between the legs, and you see I have placed a waterproof pad underneath the patient's perineum. And I have this drape as well to collect the catheter. And I'm going to take my syringe, and I'm going to attach it to my catheter. I'm going to deflate the balloon. Okay, I'm taking everything out. Okay, and I am noting how many mLs I'm taking out, how many were put in, how many I'm taking out, and I'm going to document that. Okay, and now I'm going to take the catheter, the tape off the leg here, and I've deflated my balloon, I'm taking the tape off, and now I'm going to be telling the patient, okay, so as I take this catheter out, just exhale for me, okay? So I'm going to be pulling the catheter out, and I'm placing it on my drape here. And I'm noting this catheter for any blood, any mucus, different color. I'm looking for anything that would point me to an infection or anything. And I can also take the tip and culture that or the catheter at this time if needed. If not, like right now, I can go ahead and just toss my catheter and put it in the trash. Okay, and I'm going to provide some cleaning for my patient. I'm going to, with hot water, I'm going to pat dry, make them comfortable. I'm going to put their gown down or their blanket and go ahead and pull their linen up and take my bath blanket out, and make sure that they're in a comfortable position, and make sure that their surroundings are safe. The bed is low and locked, their call light within reach, rails are up, and everything is in working order. And I'm going to thank my patient, and I'm going to wash my hands for 20 seconds per CDC guidelines, and then leave the room.